Now we're looking at the next type of drugs that are used in the treatment of asthma, and we are looking at classifications, categories like that. You know, so there are a set of drugs that are collectively called the phosphodiesterase inhibitors. So when you hear ACE, you know that what this is an enzyme. So inhibitors, that basically those drugs, they block the actions of that enzyme. So here we'll talk about the enzyme, we'll talk about the actions, we'll talk about the examples of drugs and how they are able to block this enzyme, okay, and why it actually brings about some relief in asthma. So what are phosphodiesterase inhibitors? Phosphodiesterase, first of all, they are enzymes that break down cyclic nucleotides like the cyclic adenosine monophosphate, the cyclic guanine monophosphate. These ones, they usually regulate smooth muscle tone and inflammation, okay. So in asthma, you should know that airway obstruction is going on, inflammation are usually going on. Do you understand? So basically they are going on because of reduced cyclic adenosine levels in the airways. So when you block those enzymes, it will lead to increment in the cyclic adenosine monophosphate. So this will now lead to what? The muscles relaxing and inflammation stopping. Are you getting the whole gist? So mechanism of action is they actually block the phosphodiesterase enzyme, leading to high levels of cyclic adenosine monophosphate. So this will relax the airway smooth muscles, okay, and they also reduce inflammatory mediators like cytokines, the leukotrienes. So this will reduce inflammation. They also regulate your immune system, okay. So examples now, which is very important, we have drugs like the theophylline. Alright, those ones are non-selective. Then we have the selective ones. We have drugs like the roflumilast, okay, roflumilast, right, the cilomilast, okay. So clinical uses, theophylline is widely used as a controller medication. It's now commonly used because it's now less commonly used because of toxicity and because we have better options though. Then we have the roflumilast, is mainly for what? Chronic obstructive pulmonary disease, mainly, not really using asthma and all of that. But just so you know that for this category of drug, we are discussing it because right now they are experimenting on a lot of drugs that actually fall under this category.